we've been working in Sudan since 1979. We work to support farmers in growing more food. We work to support income opportunities for women. We support food and training for mothers to ensure that their children stay healthy and well fed. We run community healthcare clinics, and we also provide support to refugees and displaced populations. Overall, what we are seeing is that I would say approximately 80% of our work is still able to be delivered at this time. There is, as you said, catastrophic events in Khartoum and in parts of Darfur. In other parts of the country, they've been slightly less impacted by the conflict, and we work very hard to be maintaining services for people. An important timeline for us at this point in time across the country. Sudan is typically a very food insecure country, and we need to be making sure that people have got seeds, tools and agricultural support so that by the end of this month they've got their fields prepared and are able to grow the crops they will need to be eating for the rest of this year.
I mean, good to hear that perhaps the majority of your work seems to be going on unaffected. When you speak to your colleagues on the ground in the affected areas, what are the challenges that they're reporting back to you?
Well, that would be in areas of Khartoum and in Darfur in the west of the country. And certainly what people are saying, if you look at a personal level, they're suffering real challenges in access to water, access to food, access to health services, phone services, internet. Many of the things that we expect in our day-to-day lives, they just cannot access this anymore. People in Sudan are extremely resilient, but these latest clashes have really pushed that resilience beyond the point that it can sustain them, and they're crying out for help and assistance. But we do, as you mentioned at the start of this interview, we really need meaningful commitments to a ceasefire by all sides involved in this conflict. We need to be ensuring that we've got safe access to communities for humanitarian assistance, and we need to make sure that we've got corridors and financial means to be delivering that assistance to some of the most vulnerable populations in the world at this time.
David, which supplies are most in need, and what are the worst shortages?
We've suffered for some time now, even pre this crisis, we suffered with medical supplies. So medicines are very much needed. Obviously, the medical facilities, though they're struggling to maintain continuous services to the population. I think many people are now struggling to access cash. And I hear many agencies now just working extremely hard around the clock to make sure that people have got the money they need and to keep banking services open. Shops are open periodically in Khartoum, but widespread looting means that many of those shops don't have the goods that people would be looking for there. And I think, as I say, we are extremely concerned, both in the short term, but when we look medium to long term, about making sure that people have got enough food to eat. In a good year, approximately 1/4 of the population of Sudan go hungry. And this is so far from being a good year at this point in time that we are extremely concerned about how this will play out.
David, good to talk to you. Good luck with your work, and thanks very much for your time. David MacDonald, the Country Director for CARE International in Sudan.